Hi, my name is Tim Verheeren. I've been a dentist for 21 years, with experience working for 7 years in public health and 14 years in private practice. In just my time, we've experienced huge changes in the field of dentistry, but some things have not changed. Dentists are an interesting bunch. We take pride in our abilities to create the ideal fillings, have invisible crown margins. We will debate the relative merits of bonding cements and composite filling materials. Our focus tends to be on procedures rather than on the complete human. Does the best dentist have the best technology? What does the office space say about the dentist and health? Some dentists have incredible skill at crafting meticulous margins and superior preps for restorations. Are they the best? The answer has more to do with the patient than the doctor. Brushing and flossing are the most important factors. Every filling and every crown prep will fail given time. If we never had to do the restoration in the first place, everyone comes out ahead. If you ask the average person if they floss, most will say yes. But when you follow up with how often, you'll hear many answers. I floss once a week. I floss when food gets caught in my teeth. I floss every other day. The sad truth is that most people do not floss the recommended amount of at least once a day. Bacterial plaque will be able to turn carbohydrates into acids after only 18 hours. You have the choice of flossing, getting cavities, or eating no sugar. The CDC did a recent study of how many people were flossing. This is what they found. 32% of people never floss. 30% do what their hygienist asks and floss daily. The boys are worse. 39% of males never floss. It also gets worse as you get older. 45% of people age 75 or more never floss. People who earn less are also less likely to floss. Often we hear that dentistry has an access problem. This data suggests a compliance problem. While tooth problems are most readily demonstrable, the body is connected as a whole. What affects one part will affect all parts. Connection between diabetes, periodontal disease, and caries has been well documented. Less well understood is the connection between cardiovascular disease and endocarditis. Pregnant females have had issues with low birth weight and premature birth. Alzheimer's recently made the news, and the effects of that study are huge. Back 100 years ago, we did not give much attention to teeth. Most people went to the dentist when they had a problem, and dentures were considered a blessing that could not happen soon enough in a person's life. Fast forward to the present, and teeth are considered an asset that should be preserved for your whole life. Issue of self-image and self-expression are wrapped up in our ability to smile. Many people do not keep recommended preventive measures, and the costs escalate quickly. The recent linking of Alzheimer's and periodontal disease could have huge ramifications on what healthy aging looks like. Researchers were able to culture a bacteria found in the bottom of periopockets in the brains of victims of Alzheimer's. The plaques found in these brains could be caused by this bacteria. Currently, our best way to treat periodontal disease is to utilize deep cleanings and cleaning the mouth every 3 months with a hygienist. The link between diabetes and dental health is well established. Medical costs of diabetes has been rising dramatically. From 2007 to 2012, it rose $71 billion. The average medical cost per individual per year is $13,700 a year. Dental care can decrease that expenditure by $1,500 a year. Dental health rewards is a concept that by rewarding good dental practices, people will need less care and experience better health. How do we motivate people? Education is necessary, but it never gets us all the way there. Two proven motivators are time and money. Dental health rewards uses money. We trade a better deal in dental costs for compliance in brushing and flossing. Dental Health Rewards has a proven track record in creating behaviors that decrease dental costs. We trade a reduced cost for increased in accountability in oral hygiene and responsibility for correcting persistent infections like periodontal disease. 50 dental patients were tracked for 1 year and compared to 50 dental patients from a common PPO insurance program. We examined the number of times that patients experienced a 4mm pocket move to a 3mm pocket or better. Dental Health Rewards patient population experienced far more resolution of the pockets than the insurance control group. This is a small study, but it points to the next step to use these principles in a larger cohort. Issues of compliance always come up. How will you know that people are doing what they say? The answer is we never will. Hygienists know that if you are a parking lot flosser by the amount of inflammation and bleeding that occurs during your cleaning. We know when people are not doing what they say, but it is also our experience that most people are truthful. When we have someone in the program that is not following the recommended protocol, we will ask if they are ready to repromise or if they would like to pay more for their treatment. Rather than making money off of people who do not utilize the benefit, we make money because people take care to do what they need to do to become and remain healthy. We challenge people to become their best selves and do what they can to get their health back. Creating profit by not being healthy will ultimately cost everyone more money. While the premise of Dental Health Rewards is quite simple, implementation of the program would require changes on all parties. Insurance, doctors, third-party payers, and patients would all have to come together and implement a program that has not been executed before. We welcome your contribution to this idea of creating health by creating responsibility at the level where it can move the needle. Thank you so much for your